we're going to have to figure out how to live with this virus. I know it's hard for people and there's a lot of grief in this. We're not going to go back to a time like we had in 2019 where we had never heard of this. The virus is with us. And frankly, how each of us lives with the virus is going to be different. It's going to depend on our age, our health status, our family situation. Do we live with somebody who has a condition where they're immunocompromised? Do we have multi-generational households where you maybe have more vulnerable, older family members living? It's also going to depend on our risk tolerance. People in life, people have different risk tolerances for things. Some people like to bungee jump. Some people have been perfectly happy to retreat more to their couch over the last 2 years. And most importantly, our response is going to have to ebb and flow with the virus itself. We are all hoping and praying that we don't see another variant like Delta or something as transmissible as Omicron, but the truth is we don't know. We can hope and we can plan, but nobody can say with any certainty exactly what is going to happen. And that's really been the case for the last 2 years. We have been responding to a highly mutating virus. We understand the frustration and people saying, oh, the guidance keeps changing, but it's changing and adapting again to keep pace with a virus that keeps throwing us curveballs and keeps surprising us with every twist and turn. And so the lesson and the thread throughout all of this is we need to keep reshaping our responses. We need to keep individualizing them based on what we learn about risk to individual people, individual population. And we also need to be mindful of the tools we have. Again, as time has marched forward, we have so many more tools available to us, whether they're the monoclonal antibodies, the antivirals, better data about quality of masks, all of it. We are learning, and when you know better, you do better. And so at the point where we stand right now with declining case counts, positivity rates, and hospitalizations, we can say that the risk is lower on a population level. The risk is lower today than it was in early January when the governor referenced we were seeing 3,000 cases a day. But again, the risk is different depending on the person. So on a statewide level, the risk might be lower, but somebody who has cancer, who has multiple underlying conditions, somebody who's older, even in this period of our state doing better, they may still have more risk than somebody who doesn't have those conditions or is younger. So again, an important thing that we can all do, and you're going to continue to hear us talking about it, even if it's not in a press conference setting, is really the vaccinations and the boosters. Having people be eligible and complete their series of vaccinations when they're available. And the reason for that is the science is clear. The vaccine significantly reduces the risk of severe disease because it prepares our immune systems to fight and face the virus when we encounter it in our communities or in our homes. And very importantly, again, with billions of people and over 1 million doses in Delaware having been distributed, we know that these vaccines are safe. They are safe and they are effective. And more importantly, or maybe not more importantly, but equally as important, and a credit to all of the many partners, whether they're the National Guard or the DELDOT workers who have staffed vaccine sites, to our clinicians, is these vaccines are available in every corner of our state right now. And obviously continued shout out to the Division of Public Health team and the DEMA teams that continue to work on this every day, as well as our community partners. So in the meantime, again, we're going to continue, the medical community and the scientists and everyone are going to continue to gather more data. Healthcare providers are going to continue to gain access to therapeutics and things that can help us continue to live with the virus. And both we and the world at large are gaining more knowledge about COVID-19, the virus that causes it, SARS-CoV-2, as well as what type of damage it can do to people. But again, none of us know for certain what the future holds, and we all need to minimize the chances that we get or give the virus to others. And we also want to embrace moments, hopefully lasting moments, when the virus is in retreat, which again is what we're seeing right now.